I want to thank everyone for being here for this extremely important event. I'd now like to introduce our speakers. Our first speaker will be Ms. Courtney Glenn, who is a doula, a community advocate, and a member of the Black Breastfeeding Week RVA planning team. She will then be followed by longtime breastfeeding supporter and advocate, the Honorable Delegate Dolores McQuinn. Following Delegate McQuinn will be our very own Mayor LeVar Stoney, who will offer remarks and present the Black Breastfeeding Week RVA proclamation. Again, thank you for coming and joining us for this very important event. Thank you. Now, Ms. Glenn.
Good afternoon to Mayor Stoney, City of Richmond staff, and those who have worked alongside us to bring this week of celebration and cultural significance to fruition. My name is Courtney Glenn, a member of the Black Breastfeeding Week RVA Planning Committee, and it is my honor to speak with you all today. Today, we stand on the shoulders of our ancestors and elders who were made to believe that nourishing their children by breast was shameful, inappropriate, and often prohibited. Today, through education, self-love, and years of restorative work in our communities, we are proud to declare breastfeeding the first food through which we choose to nurture our community's soul. As a birth worker, I encourage women and families to consider breastfeeding the first line of defense against physical, emotional, and spiritual challenges that have the potential to affect a child's well-being. Tasha Dixon, a local mom, breastfeeding advocate, and member of the Black Breastfeeding RVA Planning Committee, shared these thoughts with us that I believe carry the spirit of this week's celebration. This week is so important to me because as a Black breastfeeding mom, I recognize and want to bring awareness to the disparities in my community and want breastfeeding to be normalized and encouraged. I want our work to spark a conversation about the benefits and impact of breastfeeding for both mom and baby during the postpartum period and the rest of their lives. On behalf of the committee, we recognize that for so long, breastfeeding has had an understood but unwarranted stigma among Black people rooted in oppression. Black Breastfeeding Week RVA is the beginning of a spiritual and cultural reformation for our communities. Today, we celebrate. Thank you.
Good afternoon, Mr. Mayor and members of the Planning Committee, as well as all of those who are standing here today in support of this week. As the Mayor signed the proclamation celebrating Black Breastfeeding Week, RVA, what I want us to know, and I'm sure based on what the previous speaker said, that breastfeeding is not a new phenomenon for African American women. But since slavery, Black women have provided nourishment for their children and for white babies as well. This topic has sparked much controversy over the last few years, but I'm pleased to know that we are a part of the conversation. At some point, probably after World War II, it was shameful. It was difficult for particularly African American women, other women as well, to focus on breastfeeding their children. I myself did not breastfeed my child, but I didn't experience that, the breastfeeding as a mother. But as a grandmother, I've been a supporter and an encourager. After several lactation visits, I found myself coaching my daughter as she embarked on her first breastfeeding journey almost 5 years ago. Watching her commitment and hearing of all the benefits that my grandkids would gain, I wish I had experienced it myself. But as a grandmother, it has been beautiful to witness. I was diagnosed with breast cancer when my daughter was 9 years old and I was 35 years old. She said that knowing breastfeeding could reduce both her and her daughter's chances of having breast cancer has been one of her biggest motivations to nurse her children. A mother's ability to not only birth her child, but also nourish is nothing short of absolutely amazing. As a legislator, I have pushed this issue and I will continue to push it in every capacity that I could think of. And so thank you to Mr. Mayor for lasering in on this week and this issue to create Black Breastfeeding Week, RVA. We stand with the national organization in partnership, and we stand with you. Thank you.
Well, good afternoon, everyone. Good afternoon. I want to thank you all for being here on this very special occasion as we celebrate Black Breastfeeding Week. Earlier this month, I had the opportunity to visit with Heart Healthy Plus, their program of mommies, babies, bellies, and daddies. Or bellies and babies might be in between there, but y'all know what I'm trying to say. August is National Breastfeeding Month, and today I am proud to proclaim August 25th through August 31st as Black Breastfeeding Week in Richmond, Virginia. It is estimated that if 90% of U.S. mothers could achieve optimal breastfeeding, we could prevent about 2,600 premature maternal deaths and more than 700 child deaths each year. We could also save $17.4 billion in maternal health costs and $13 billion in child health costs annually. Research shows that breastfed babies have lower risks of asthma, obesity, ear infections, diarrhea, sudden infant death syndrome, and type 2 diabetes. For mothers, breastfeeding is associated with lower lifetime risk of heart disease, breast and ovarian cancer, and type 2 diabetes. Yet, significant racial disparities exist in breastfeeding initiation and in duration, which in turn impact the short and long-term health of Richmond's African American citizens. Black Breastfeeding Week co-founder Kimberly Sills Allers lists 5 major reasons why Black Breastfeeding Week is needed. Reason number 1, according to the CDC, increased breastfeeding among Black women could decrease infant mortality rates by as much as 50%. And you all know those rates are on the rise at the moment. Reason number 2, breast milk has been proven to reduce the risk of asthma, obesity, heart disease, and diabetes, conditions that are higher amongst African Americans. Reason number 3, Black Breastfeeding Week provides an opportunity for all of us to celebrate and showcase the breastfeeding champions in our community who are often invisible. It also encourages our health and other institutions to do a better job of diversity representation in the location and support in this field. Reason number 4, Black women have a complex history connected to breastfeeding. From being forced to neglect their own children to breastfeed slave owners' children as wet nurses, to lack of societal and medical support and misinformed cultural norms that do not support breastfeeding with the Black community. All these factors require focused attention, and we're going to do that this week. Reason number 5, many African American communities are first food deserts, and where families cannot access support of infants' best first food, which is breast milk. As we all know, breastfeeding African American or Breastfeeding Week at RVA, Black Breastfeeding Week, should not be just this week. It needs to be every week in our community. So let's spread the word that breastfeeding builds health and resilience for all of our mothers, babies, families, and communities. Black Breastfeeding Week in RVA is an opportunity to strengthen our community support to address the dismantle the stereotypes around breastfeeding and barriers that disproportionately affect women of color, including the lack of paid family leave and workplace support, ill-informed cultural norms, and the lack of culturally relevant lactation support. As you know, we here in Richmond have taken significant steps to show support for the mothers and families in our city's workforce, offering up to 8 weeks now of paid paternal leave to welcome children or care for a sick loved one. In declaring this week Black Breastfeeding Week here in Richmond, I challenge our city's hospitals, our businesses, agencies, and coalitions to work together to build a more equitable, breastfeeding-friendly community for everyone. For everyone. Everyone. May our collective work foster enrichment that is known far and wide as a mother, baby, family-friendly city that provides culturally relevant, appropriate, and equitable support for all of our citizens as they pass through the significant life transition of pregnancy, birth, and early parenting. So I want to thank all the organizers, the supporters, and mothers who are lifting up such an important topic in our community. And let's celebrate Black Breastfeeding Week in RVA together. Not just this week, but every week as we go about building one Richmond. Thank y'all so much. Now, one of the many powers I have as mayor is I get to proclaim days, weeks, months, years, celebrate people. There's no better opportunity now to present a proclamation and sign a proclamation celebrating Black Breastfeeding Week here in Richmond. And so I'm not going to read the proclamation because y'all already heard me speak already. But I'm going to say, now therefore I, LeVar M. Stoney, Mayor of the great city of Richmond, do hereby proclaim the week of August 25th to the 31st, 2018 as Black Breastfeeding Week RVA in the city of Richmond and support the efforts of all citizens and organizations who are committed to help our city become more dedicated to important health matter. And I will sign it right now. Nakai, I'm supposed to be giving this to you. Here we go. Let's hold it up for the cameras.